for more to join on the call. I would like to run through a brief bio of our speaker for tonight, Dr. Abdul Razak. When Dr. Abdul Razak, it's a pleasure to have you on the call today. So, Dr. Abdul Razak Wuni, actually, PhD certified Ghana, BSc Ghana, PhD Cardiff, United Kingdom. He is an accomplished academic leader and health sciences expert with 2 decades of progressive leadership experience across higher education, healthcare, and research in Ghana, the UK, and the United Arab Emirates. He combines transformative vision, operational excellence, and a deep commitment to inclusivity and student success to deliver measurable impact in teaching, research, and community engagement. Currently serving as assistant professor and deputy head of department at Fatima College of Health Sciences, UAE, Dr. Wuni leads strategic and operational initiatives, including curriculum innovation, faculty development, accreditation, and applied research. His leadership has strengthened partnerships with hospitals and clinical trainings, expanded access to supervised practice by 40%, and improved student academic outcomes by 12% in 1 year. Previously, at the higher colleges of technology in Dubai and the University of Cape Coast in Ghana, he advanced student-centered learning and applied pedagogy at significant gains in participation and pass rates while supervising award-winning capstone projects. As the head of radiography at the University of Ghana Hospital, he provided visionary departmental leadership, embedding regulatory compliance, quality assurance, and staff mentorship across all operations. A recognized thought leader, Dr. Winnie is an external examiner for 2 universities, a journal reviewer, and an award-winning researcher whose COVID-19 radiography study received the Editor's Choice Award on the Radiography Journal 2021. His scholarship spans radiography education, workforce development, applied sciences, and artificial intelligence in medical imaging. Dr. Wuni is so passionate and an advocate for equity, diversity, and inclusion, consistently building collaborative environments where faculty, students, and staff thrive. Ladies and gentlemen, it's with great pleasure. If this was an open space, I think instant innovation, we should make one page. Our guest speaker for tonight, Dr. Abdurazak Wuni. Doctor, if you're there, the floor is yours. You can say hi.
Yeah, hello. Thank you very much for the very kind words you had to say about me. But I'm just an ordinary young man like every one of you, so nothing special about me. Yeah, thank you.
Thank you so much, Doctor. We are so happy to have you amongst us this evening. So, without further ado, we can have the mic and lead us on today's session, sir.
Okay.
Yeah, thank you, sir.
Let me see if I can share my screen. Can you see my screen?
Yeah, visible.
Yes, you can see your screen, sir.
Is it changing? Is it changing when I change
Yes.
it?
Yes,
Yes, it is.
yes.
Okay. So let's do it this way. Today's session basically, it's, if I understand what I was asked to do, is to try and build sort of develop the interest for those who do not have the interest yet, build capacity for those who already have the interest, and find ways by which together we can ensure that this cohort we are able to move away from ideas in research to the point where we get publications from this group. So it's about the whole research journey. So if what I get is right, and that's basically what we're going to. We're going to look at the foundational research development for medical imaging professionals. We want to be able to build confidence. Now, to get confidence, we need to be able to build competence. So we need the competence, we need confidence, and we need to show practical and impactful ways by which we would be able to conduct research and end up with impactful publications. Now, I know for a lot of us, we are looking at the challenges involved. We would look at, yes, some of the challenges that you are likely to face, and we'll look at possible ways of going around it. What I would offer would be sort of like a guide. I would be there with you through the process, navigating through the process. If there are some of the road places that you need to navigate, that you have challenges, then I can come in and then we can navigate those challenges together. So basically, that's what this journey is going to be about. But this particular session, what do we want to do? We want to understand. Everybody says research, but what exactly is the value of research in our practice as imaging professionals? So we need to understand the value of research in what we do. But is it everything that is researchable? So we want to be able to identify feasible research, things that are researchable. How do we develop this interest? And the interest that we are developing is in areas that are researchable, they are feasible, they are possible for you to conduct research in. Then generally we normally have ideas, and for a lot of us it remains ideas. How are we going to be able to convert these ideas into research, and then at the end of the day we are able to publish from those ideas? So the process of converting ideas into research, into publishable work, is one of the things that we would be looking at. For a lot of us in low and middle income countries, mostly in Africa, the political correct language is low and middle income countries. We know that resources are limited, but that should not stop us from research. So how do we go about to conduct research that would not be too expensive for us to do? And then we'll identify some of the common problems that we would meet and how we can navigate through these problems. So that's what we are seeking to do in this session. Now, research. What exactly is it? So you would find, so for instance, when lawyers get a case, the first thing they say is that, okay, after the client had briefed them about whatever the case is, they say they need to go and do research to find how they can handle the case. So they would use research in that way. But basically what they are saying is that they need, after you have told them the story, then they would ask very important questions of your story to enable them find answers to those questions and to be able to solve the problem that you came with to them. So basically in research, what we are doing is that we are doing it in a systematic order, not in a haphazard manner. We are doing it in a systematic order, trying to find answers to important questions. It could also be that there is a challenge, there's a problem, and then we are trying to do this to find solutions to those problems. In some other instances, there is no problem. It's not exactly a problem, but we don't have any evidence about that particular situation. So we want to be able to generate evidence to support a popular belief or to demystify a popular belief. So we generate evidence. And research for a lot of the areas, for it's a lot of people also do research because they want to develop innovation. So there has been an old way of solving a problem or doing a particular thing. And through research, they can find better ways or innovative ways of solving it. So you could end up doing research in those ways. But for those of us in medical imaging, when we do research, we say it's systematic and we are trying to solve problems. We are trying to do things in a better way, or we are trying to generate evidence to back a popular belief or a myth to demystify something. For us in medical imaging, one, we are looking at the protocols that we are using. Is there a way research can make those protocols better? We talk about patient safety and we talk about radiation and all of that, patient dose. What ways are we going to be able to reduce the radiation dose to ourselves and to the patient? Can research help in reducing radiation dose? Patient outcome is largely dependent on image quality, infection control, and so on and so forth. Are we conducting research that can improve upon the patient outcome and so on and so forth? So for us in medical imaging, the research has to improve patient outcome, improve upon radiation safety and use, and better imaging protocol, so that generally the patient experience in imaging is improved. But why is it important? Why should we, as imaging professionals from Africa, be interested in research? One, whether we like it or not, our field is highly technologically involved. So as technology is improving and advancing, our field is rapidly changing. When I trained as a radiographer, at the time, computers used to be very slow. And as a result, the CT scans that we had at the time were generally very slow. So when I trained, the only CT that we had in Ghana at the time was 2 slides per minute. And so if we were going to do a head CT and we needed 60 slides, it meant that the patient was going to be lying down there for 30 minutes to be able to get 60 slides, because it was 2 slides per minute. But because of technological advancement, now we have CT scans that are 640 slides per minute. So as technology improves and gets better, our work evolves with technology. So it matters to us that we evolve as technology is evolving. And one of the ways of doing that is ensuring that we continuously do research to be abreast with the changes that are happening. Now, one thing that has happened that a lot of people are scared, some are worried, some are optimistic about is artificial intelligence. Artificial intelligence, whether we like it or not, has become a part of our everyday work. So, and the newer equipment that are being produced have AI embedded in most of them. So we need to be able to develop our own data to be able to support the development of AI. And we are not going to develop our own data if we don't do research. We need to also look at those optimization. Everything that our work is about ensuring that at every point in time, we do not forget Alara. The only way we would be able to use Alara is if we are able to optimize those. Then we want to improve upon patient experience as they walk through our departments. So we need to look at the workflow. If the workflow, people are waiting for longer hours because they are bottlenecked somewhere, we might need to redesign the workflow. How do we redesign the workflow if we have not done any research to see where the bottlenecks are? And then we need to be worried about patient safety. But most importantly, for those of us in Africa, we cannot sit for somebody to tell our story for us. The healthcare system that, of course, it is true that healthcare everywhere is healthcare. But we have specific problems that are specific to our situation, and that might not apply anywhere else. Now, let me give an example. When I was a student in the UK, this student, I was supposed to take radiography students through radiography in Ghana, just a general overview of radiography in Ghana. And one of the things that came out was that at the time, we were moving from analog to digital system, but the digital system that we had moved to was CR systems and not DR. And trust me, the students didn't know what CR systems were. They had never come across some. And even here in the UAE, my students, when I talk to them about CR, they don't know CR because all of their hospitals have DRs. So if they don't know CR, they would probably never have heard about automatic processes with developer, fixer, and washer, and rulers, and all of that. But then there are still places in Africa that you would possibly come across automatic processes. And there are lots of places in Africa, lots of places that are using CRs. So our systems and our challenges would be very different from the rest of the world. So we need to be able to tell our own story. We cannot depend on anybody to tell the story. For those of us who are in universities, it is one of the things that you are expected to do. You are expected to produce research. And for those of us who are teachers and lecturers, we are supposed to serve as mentors to our students, and we need to be able to show them leadership. Now, if we ourselves are not very conversant with research, it's going to be a little difficult mentoring students in that area. And if you are teaching, you need to continuously improve your teaching methods for it to continuously be relevant in the clinical area. So you need to continuously research to improve upon your teaching method and to be abreast with the changes that are in the clinical area. If in this age and time, we are still teaching and examining students on wet processing, they need to take the film to the dark room, put it in the developer in complete darkness. They take it out, they wash it in the water before they put it in the fixer. It just means that we are not abreast with time, because it is unlikely that students would have to use those ones, wet processing. So we need to consistently be abreast with what is happening in there. And if we do not open our eyes into research, we are probably going to be stuck teaching things that are no longer relevant. Now, when we look at research generally in medical imaging, there are two areas that we normally say. We say that research is important in medical imaging in two areas. One, it has a clinical impact, and two, it has an academic impact. For the clinical impact, we want to improve upon the images that will produce diagnostic accuracy. We want to reduce the radiation dose. We want to improve upon our workflow, and we want to, generally, the patient experience should be more enjoyable. Of course, the patient is not coming to the hospital for enjoyment, but once they are there, you need to ensure that the process that they are going through is not going to put further strain on them, because they are coming there already because they are sick. For academic impact, those of us in academia, you need to publish for your promotion. Your career would not advance without publication, so you need a research. So there is what they call in academia, publish or perish. So you need to publish to get promoted, or if you don't publish, you perish. And then the more you publish, the more your name is out there, the more you are visible, the more you would be invited to international conferences to speak. And once you do that, you are visible everywhere. And that is, you are more likely to be able to win grants and other people wanting to collaborate with you. And the more you publish, the better the way you go about your teaching, because consistently you are researching and looking for better ways of being able to teach. Now, I have said that we should not allow anybody to tell our story for us. Now, if somebody goes to conduct research in, say, the Netherlands about healthcare, and then brings that research to Africa and tries to impose the solutions that they found to the challenges, say in Netherlands, in any of the countries in Africa, it's unlikely that those solutions would work. So we cannot depend on evidence from elsewhere to solve our problems. So we need to generate our own local evidence to be able to solve our problems. Now, for instance, one of the very common diseases that's still in Africa is malaria. If you're an African and you go to any of these European countries and you get malaria, they'll go and put you in an isolation ward and isolate you like as if you're a patient with COVID, because they don't know how to deal with it. They feel that it is contagious and somebody else could get it by speaking to you or touching you. So our disease burden is completely different from their disease burden. Now, I'll give another example, for instance, in Ghana. So if you were to be in Ghana, you happen to be, say, in the northern aspect, the northern part of Ghana. Vast landmass, the landmass would be about 40-45% of Ghana. And then you would find that there is only one MRI machine, which has been down since I was a PhD student in 2016, 2017, never been fixed. You would find a couple of CT scan machines, 3 to 5 at most. So what increasingly you find is that the patients that are reporting to the hospital are reporting to the hospital with a condition that is already too advanced. That is not what you find in the European countries. That is not what you find elsewhere. So you cannot bring their solutions here and expect that they work. One of the other things is that workforce shortages, yes, there are workforce shortages everywhere in the world, but our situation is even worse. For tax shifting, so for instance, in the UK, you would find that they have radiographers that are now reporting radiographers, so they are interpreting images. So that has been tax shifting. Some of those tasks have been shifted from the radiologists to the radiographers through role extension and advanced roles. Here, we don't have that. So their reality is not our reality. So we need to be able to get locally relevant solutions to the local problems. Africa must study Africans' imaging challenges to find African solutions to African problems. Now, we are getting gradually into research proper. Now, what are the most common areas that you would find people researching in medical imaging? One, you would find a lot of research in radiation dose optimization, image quality improvement, patient waiting time and delays, equipment utilization and downtime, like equipment get broken down and it takes like forever to fix them. Then we can talk about student education and competencies. And lately, there has been a lot of research also on sustainability, environmental sustainability. Then we have AI awareness and readiness. How ready are we for the introduction of AI? What do we know about AI in our profession? Ultrasound access in rural areas, and this is particularly important because maternal mortality is a big issue. So ultrasound access in rural areas is one of the things that you find a lot of research in. And during COVID, we found a lot of research on infection control in imaging units. Then reporting turnaround time. So reporting turnaround time has been one of the areas that has been well researched in the West. In our parts of the world, it's still a big area that people are, it's still an area that there's a lot of work that still can be done. And then for patient satisfaction, a lot of us don't pay attention to patient satisfaction, but we have work because there are patients. If there are no patients, we don't have work. Now, where do we get good research ideas from? Where do they come from? The thing is this. The way we look at research might be the reason we are not consistently generating researchable ideas. To be able to generate ideas easily, you would ask yourself, what are the problems that you are consistently observing around you? Like, you are a radiographer, you are a lecturer, you are in clinical practice, or you are in academia. What are the consistent challenges that you are coming across? What are the things that you are coming across? What is it that your students are asking? What kind of questions are they asking you? Okay. What are the type of questions they consistently ask? Patients and your colleague staff, they are making some complaints. What are the things that they are consistently complaining about? Within your department, have you done any audits to see, for instance, skull x-rays, for instance, that has done in your department? How many of them did you have to reject and have to repeat? Have you done reject analysis in your area? Have you done how many times, how many images have had to be repeated because the image quality was not good enough? What are some of the inefficiencies within your department? You work there, you have seen inefficiencies there. If you are in clinical practice, you are working there, you have seen it. If you are in academia, you are probably seeing how students are graded. You have seen assessment methods that are being used. You have seen how students are being taught. Do you feel that those ones are the best, or they can be improved? Do you see any inefficiencies in what it is that you are doing? You have probably read one paper or the other. When you read that paper, did you come out with a feeling that there is an aspect of this topic that this paper is dealing with that has still not been explored that we can explore? That is a gap. Have they introduced any new policies within your clinical practice or within academia in the institution where you are, and you want to find out whether those policies are serving the purpose for which they said they were formulated? So you can evaluate those policies to see if indeed the policies are achieving what they were put out to achieve. Now, research basically just starts with you are curious about something. Then you observe what is being done. Then you decide that, no, this is something I want to investigate more about. Then you go ahead. We said, look at problems. Okay, I've looked at a problem. The problem that I find is that in CT, there are long waiting times. So how do you turn these long waiting times into something that can be researched? The question is, you ask yourself, why are people waiting for so long during CT? What are the factors that make the people wait for long? What is the perception of the patients in waiting for that long? Then you look at what could be the solutions. So, for instance, if we were to introduce a booking system where people are booked for particular hours, will it reduce the waiting time? So instead of asking every patient to come at 8 a.m. when you know that they might end up doing their case at 2 p.m., why not ask them to come at 1 p.m.? So that is how you go about it. The problem is long waiting hours. Why? Then you ask looking for why are they waiting long? What makes them wait for that long? How do they perceive their waiting for those long hours? Then you're asking yourself, what intervention can we use to reduce the waiting times? So that's how you go about turning these problems into researchable questions. Now, but research questions should have some critical features. The research question that you're asking, is it relevant? Is it clear? Anybody who reads it, will the person get a clear understanding of what it is that you are asking? Is that question specific enough so that we know that this is what you mean? Is it feasible? Is it something that we can research? Can we answer the question that you are asking? And you need, when we say it should be specific, we mean that don't give us a question like radiography in Africa. What about radiography in Africa? That is not specific enough. So if you say factors associated with repeat chest X-ray in a tertiary hospital in Ghana, that is specific enough. But is this relevant? Yes, it is relevant because we are repeating chest X-rays, which means that additional radiation goes to the patient. Is it clear enough? Yes, it tells us that we are looking for what? Factors associated with repeating of chest X-rays. And it is specific because it is telling us it's in a tertiary hospital in Ghana. Is it feasible? Yes. It's in a tertiary. We didn't say we are conducting it in the whole of Ghana, every imaging center. We have selected where we want to do it. Can we answer the question? Yes. So you need to ask yourself this question. Is it relevant? Is it clear? Is it specific? Is it feasible? Is it answerable? Now, for every one of us, it's not everybody that just wants to research anything. So for some of us, we only research things that are of interest to us. How do you identify your research niche? What is of interest to you? What's important to you? You ask yourself, if you are in academia, what do you teach most? If you are in clinical practice, you can still ask yourself that question. What do I teach most? Because in clinical practice, when the students are on clinical placement and they come to you, you still teach them. So you could be asking that. Then you could also be looking at, if you are particularly for clinical area, what clinical area is of interest to me? For some people it's CT, for some people it's MRI, for some people it's specialized imaging. It could be IVUs if we still do them, HSGs if we still do them, barium mills, barium edema, and so on and so forth. So what is it that is of interest to you? What data can I readily have access to? There are problems or challenges that we encounter, but which particular one is the one that frustrates you the most? The one that you can't just deal with. You don't understand why a solution has not been found with for that one. What is that problem? You can identify that and do research to find a solution to it because it frustrates you more than anything. Now, here I've used 3 years, but it doesn't have to be 3 years. If what you are seeking to research on is something that you think will take you up to a year, do you think that it is something that you are willing to spend 1 year researching on? So the 3 years is just as a guide. The length of time that you need to finish that work, you should ask yourself if you can sustain that piece of work for that period. So your niche basically is about one, your interest, but it doesn't end at your interest. Is your interest relevant? Would you be able to have access to data? And one of the common things that I normally say to students is, one, somebody says that his interest is seeing the face of God and being able to determine if God has a beard. But how relevant is it to the rest of us if God has a beard or doesn't have a beard? And where are you going to be able to access the data to find out if God has a beard or God doesn't have a beard? Yes, it's your interest. We can't take that away from it, but it's not relevant to the rest of us, and you cannot have access to that data. So that's not something that is feasible. That's not something that you can research on. And when you are selecting an area to research on, you normally start from a very broad topic, and then you begin to fine tune it and narrow it down. So in this example, we are looking at CT imaging. So CT imaging could be any examination at all that we do with CT. So, but in this case, we said we are looking at CT imaging, and we've said that, okay, let's look at just the radiation dose bit of CT imaging. But even with the radiation dose, we don't want to look at all CT examination. We want to look at only head CT. So the radiation dose that we are looking at is for patients undergoing head CT. But even the head CT, we are not looking for patients, non-trauma patients, patients who have not been involved in any trauma. So we have narrowed it down further from just radiation dose to head CT, and even the head CT, we want only those who were involved in trauma. And then, even for those who were also involved in trauma, we want only those who had repeat scans. So, if you had a head CT and it was true trauma, but there were no repeats, we are not looking for you. So you must have had a head CT resulting from trauma, and there must have been a repeat. Then you qualify. We will be looking at the dose burden for those patients. So that is how you narrow it down. you start from a broad one and you narrow it down as you go. And the topic finally then can become radiation dose burden from repeat head CT in trauma patients at XYZ hospital. So you start broad and you narrow it down so that it is not just feasible, it's researchable. Now, we also need to be sure that our research topic is something that would be worth our time. And to be able to do that, we need to pass that research topic through this framework. The framework is final, but the F is just, is the research feasible? Is it interesting? Is it novel? Like in that particular context. So let's say we are looking at, say, Enugu Teaching Hospital in Nigeria. Is it novel? The research that you want to do, has it been done in Nigeria in a similar setting to what you are going to do it in? If it's been done in, say, some other setting in some other country, that's fine. It's still novel in your area. But if it's been done in a similar setting, like you want to do it in University of Lagos Teaching Hospital, and then it's been done in University of Enugu Teaching Hospital, same group of participants, everything same. It's not novel, it's been done. Okay, so you need to go through this. Is it ethical? Is it relevant? And now, before you commit yourself to doing the research, once you have developed the topic, run it through this framework. Is it feasible? Is it interesting? Is it novel? Is it ethical? And is it relevant? Before you commit to doing full-blown work. Otherwise, you will waste your time. Now, these research generally are friendly to early career researchers and beginners. Cross-sectional studies. Cross-sectional study, we take the data at one point in time, and that's it. We don't do follow-up. Retrospective studies. So retrospective study, the data is already in the system. So if we, like the CT dose for head trauma case we are looking at, for instance, it's a retrospective study. The patients have already done it. The data is in the system. So we go to the system to retrieve that data to use it. So we are not interacting directly with patients. We are interacting with data that already exists. And then for clinical audits are also mostly retrospective studies. So the data is there, you just review it and so on. Now, knowledge attitude studies, they're generally cross-sectional studies, but we are assessing people's knowledge and attitude about a particular thing. For educational intervention, they can be cross-sectional, and then they can be longitudinal as well. So we decide that we are introducing an intervention. So for the intervention, let's say intervention A, we would assess students before we introduce the intervention. And then after we have introduced the intervention, we assess the students afterwards again, before and after, to see whether that intervention is working. Then qualitative studies, they can be either cross-sectional or longitudinal. It's just that in qualitative studies, we mostly just interview people and record it, then we'll have to thematically analyze it instead of giving them a questionnaire that they fill. This one, it's an oral interview. And those interviews could be um, it could be one-on-one interview, or it could be a focus group discussion. Now, if it's a focus group discussion, we bring a group of people together and then we ask the questions, and every one of them gets to respond. So they are all in the group, so it's like a conversation that we are all having. And then the one-on-one is just the interviewer and the interviewee interacting. Then service evaluation project. So a service that has been running, you want to evaluate it and see whether it is delivering what it was set out to deliver. Okay. And generally these questions, these type of studies, they don't require that much resources, so they can be done quite easily. Now, for me, the very first research that I did was an audit. It was reject analysis that we did. So, and at the time, we had just moved from automatic processor to a CR system. So I did a study to check our reject analysis. What were the images that were now having to repeat? What were the causes of those repeats? Which particular anatomical areas did we have to consistently repeat, and so on and so forth? Then you can also do studies about MRI safety amongst, you can do it among patients, or you could do it among students, or you could do it among radiographers. Okay. Then for those in academia, you could also, and this, it depends. If you have simulation, if you have a simulation lab in your place, then you could do this study. But a lot of African universities do not have simulation labs. If you have a simulation lab, you can then evaluate students' confidence before you introduce them to the simulation lab, and their confidence after they have gone through the simulation. And then we can do patient satisfaction by checking waiting time. And then we could also still do another type of reject analysis, but this time we are specifically looking at only mobile radiography, where we are going into the wards to do cases. Then we see how many of those images we are having to repeat because of errors. But how do you structure a research topic such that you are almost certain that, okay, this one meets all of the things that we need? First of all, you need to look at, is there an association or an effect on one variable on the other? So you are looking at the association or the effect of variable on the outcome in a particular population, in a particular setting. So when we are looking at effects, so here we are looking at effect of what? What's the variable there? Workload. The outcome on will be reporting delay. Amongst the population will be radiographers, and the setting is in Accra. Here we are looking at knowledge of radiation protection among students in the UAE. So we are looking at the association or the effect. We are looking at the variable, the outcome. We are looking at the population and the setting. So when you structure your research topic, we should be looking at whether there's an association or an effect of a variable on the outcome. We need to know the population and know the setting. Now you have identified your research topic. You want to do a literature search. Now, when I was an undergraduate student, when we are going to search for something, we normally would just search on Google. But when you want to conduct serious research, you need to search on academic databases. Instead of Google, you should search Google Scholar, you can search PubMed, Scopus, and so on and so on. There are many academic databases, CINAHL, and so on and so forth. So you should search in the academic databases. Now, in searching, what you should notice is that you would get better results if you use only the keywords in what you are searching. So if you search, say, medical imaging research in Nigeria, there are some of the words, if you leave out, it doesn't change anything. But if you put them in, then it's going to give you more articles that are not directly related to what you are looking for. So, for instance, you don't need it. So you can do medical imaging research, Nigeria. Those are the only keywords in there. So when you are doing your search, limit it to only the keywords. And when you are conducting a literature search, you are looking at basically a literature search is I want to do research in this area. I want to see what others have done in this area. How did they do it? And which aspect of this topic has still not been explored? So, what is already known is what the other people have done. What methods were used is how did they do it? The gaps that remains is which aspect of the topic have still not been researched, even after reading through all of these. So you are doing your literature search with the aim that I want to see what has been done, how it has been done, and which areas are still left out and not explored yet, so that I can explore those ones. Now, when you do your literature search and you have found papers relevant to your topic, and you take each of those articles, you ask yourself, what was the research question? What design was used? What were their results? What were the limitations of that study? Is this a study that if I wanted to replicate locally, I can do it? Will it be relevant? So any paper that you take, you need to answer these questions on the paper. So typically what I do is if I'm doing a literature review, I draw a table. And then I put each of these as columns. And then I populate it. Once I read the paper, I put the title of that paper, and then I answer all of these questions in it. So at the end of the day, I have one document that contains all of the literature I have reviewed, and I can find all of this information on it. So once you have identified your topic, you have done some review, you need to develop a proposal because you need to apply for ethics to conduct that research. Now, in that proposal, you need to have a title. The background. So this is how I look at research. Okay, so the title, you are telling me what you intend, what the area you are going to do your research. The background, you are telling me that A, B, C, and D have done this in this area. This is what they found. So you are giving me a background to the topic. The topic is this, but this is the work that has been done in this area so far. But this is the problem that still remains, and that is your research problem. And this is what I intend to do. That is your aim. This is how I intend to do it. That is your methods. And I intend to ensure that I follow laid down rules. That is the ethics. The timelines is telling me this is how long it is going to take me to finish this work. The budget is this is the resources that I'm going to need to finish this work. And this is what I expect to find out at the end of the research. That is your expected outcome. So in your proposal, you are telling me that, look, I want to do this. This is what other people have done. This is what the problem that is still outstanding. And I intend to do this. This is how I intend to do it. And I'm going to do it according to the rules of the game. This is how much time I need to do it. This is the resources that I need to do it. And I expect that at the end of the study, this is what I might find out. And that is what your proposal is supposed to convey to me when I read it, or anybody else for that matter. Now, we are in low resource settings, and we don't have expensive equipment, but we need to do research. The first places that we can start is to do retrospective study that has records that are already existing. We could also do reviews. Now, systematic reviews, we could also do scoping reviews. We could do a systematic review, meta-analysis, or just a systematic review we can do. So, and those ones, we search the literature, we critically appraise it, and then we write our reviews. Now, in conducting our research, normally we can use the free survey tools, like we create our survey tools in Google and all the rest of them that comes with it. If you are in academia, you could use your students' projects as research. So you develop that topic, give it to the student to research it as their student projects, their research project. Once they are done, you then convert that into a manuscript, then you publish it. And let's be ethical about it. When you publish those work, the student's name also ought to be on it because they did the work. Okay. With your guidance, of course. Then we can look at data from the hospital that we can use those data. But even data from hospital, we need to apply for ethical clearance to be able to use the data. Then the statistical tools, we normally will use the free ones, not the ones that are expensive and for sale. And one other way of also doing it is we are all in different places. So maybe one is One is in South Africa, one is in Nigeria, one is in Ghana, one is in Zimbabwe. We can collaborate to do research across countries. Multi-center collaborative study, we could push that as well. Now, you can use Google Forms for your surveys. You use Excel to clean the data or to do basic statistics. Excel can do a lot of those ones. Jamovi, you can use it for statistics. Zotero for citation. Mendeley, you can also use it for references and to store your PDF documents as well. Now, research takes time. Research is like a young man trying to woo a woman. You need to be conscious about it and you need to make time for it. You need to decide that, okay, this is how much time I'm going to spend on it because it is important to me. You can decide that for every week, I would spend 1 hour reading literature. I would spend 1 hour trying to write something. I would spend another hour trying to get some data. I would try to probably make some connections, some networking, maybe one on LinkedIn, on ResearchGate, any of those professional networks. The important thing is that once you are consistently doing it, consistent, even if it's little by little, you would develop better than somebody who only comes to sit once in a while and spend 10 hours trying to do it. So you need to consciously make time for it. Research requires some sacrifice, and you need to make a conscious effort for it. And you need to collaborate with others. So, for instance, we are from different places, different countries, different hospitals, different universities. If we collaborate, then we get to do more. So I have work, some project to do, and I collaborate with my colleagues from Calabar. When they have work with there, they collaborate with me. So instead of me doing one paper, I collaborated with them. So I have one, they have one. When they are doing their paper as well, they collaborate with me. So they end up getting 2 papers and I have 2 papers. So when we collaborate, we produce more. Okay. So we need to collaborate with colleagues, clinicians, physicists, statisticians, IT, other university students. When we do that, we are able to increase our productivity. Some of the challenges that you are likely to encounter is there's no funding for research. Mentorship, almost non-existent. And that's why I was very happy that a forum like this exists. I don't know, but I just feel that we haven't done enough. We haven't done enough for ourselves. One person excels, and that's it. The person is not drawing people along, and the only way you can draw people along is through mentorships. And we need more of this, and that's why I'm very happy that you guys have started this, and it's going to go a long way to help all of us. Okay. Now, for those in academia, our universities in Africa don't do this. They don't reduce your teaching load and give you dedicated hours, protected time for you to do research. In other places, that is done and it allows them to do it. So you're going to have high teaching load. And for those of us in clinical practice, it's even worse. Nobody cares whether you do the research or not. But what is important is that those in academia and those in clinical practice need to be able to collaborate for research to be done. Those in the clinical area are seeing all of the interesting cases that those in academia are not seeing. But then you need to collaborate. We need to collaborate to be able to produce high impact research from such cases. And there are a lot of people who also fear statistics, but statistics is actually very enjoyable. We need to learn it more. I I have a student and he loves statistics a lot. Sometimes when you apply for ethics, it takes forever and then you are never hearing from them, you are following up from them and they are not responding. So one of the ways I have found around ethics, particularly in Ghana, is instead of going through the universities or Ministry of Health or the Ghana Health Service, I apply for ethics as much as possible from the Ghana Society of Radiographers. And once I have that ethics, I go ahead and conduct my research. Now, manuscript rejection, trust me, it can weigh you down heavily, but know that even professors still get manuscripts rejected. So if you are rejected, don't worry, you are in good company. There are a lot of professors who still have manuscript rejected. And you would doubt yourself. You feel like I'm not good enough. And no. It's part of the process. Once you get publishing and you get used to it, the self-doubt would go. But it's normal for you to have self-doubt at the beginning. Okay, so these are common to all of us. It's not specific to anybody. It doesn't mean that you are a failure or anything. They are common. We all go through it. Now, we're going to look at each of these ones and see what do we do. No funding. Well, let's start studies that does not involve the use of that much money. We can do cross-sectional studies among students, amongst radiographers, among patients at barely no cost. So if you are not getting mentorship, you build virtual mentorships on LinkedIn, on ResearchGate, and all of those other ones. And this is actually virtual mentorship, and that's one of the ways that we can go about it. If you feel that you don't have enough time to do it, try squeezing in particular time weekly. So for instance, if it's just 1 hour every week, protect that time and say, this time, all I would do would be research. Protect that time and don't use it for anything else. If you fear statistics, try and learn the very basic ones. If your paper is rejected, sometimes they would ask you, they'll give you the option to be able to resubmit. So you can revise it and resubmit, but even if they don't give you the option, revise it and submit it to another journal. And if you feel like you are alone and then you don't have anybody to consult with, try and join a research group. And that normally should help. Now, publication can be a nightmare. Okay. See, once you have gone through all of the processes and written your manuscript and you submit it, if it's a peer-reviewed journal, typically there will be a minimum of 2 reviewers invited. So this is what happens. They send the review, the journal has a list of reviewers. So once they receive it, they send invitation to those reviewers and wait till the reviewers have accepted to review it. And typically, the minimum number of reviewers they needed for each paper is 2. So some journals can take up to 5. Now, each of these reviewers is going to review your work independently without knowing who the other reviewer is and what they are saying about your work. So, and depending on whether, if the journal is double blind, it means that the reviewer doesn't know who has sent that paper in, and then the authors don't also know who the reviewers are. So they would revise it, whatever comments they come with, the editor of the paper would send you those ones. It could be that reject, it could be minor revisions or major revisions. So it would come, if they say revisions, you would attend to those revisions, you will send it back, they will revise, they will look at it again. If they have feedback, they will give it back to you, then you do it. And it might be a back and forth process, so it takes time, it is slow. You might review your work multiple times. And this whole process is to make your work better. Sometimes you don't have to agree with everything that the reviewer says you should do. If you don't agree, you tell them you don't agree and explain why you don't agree and why you think you should not change it. If you make sense, they might just accept it and move on. Now, first of all, you need to identify your topic. You have gone through the whole thing. You have gotten ethics, you've collected data. Then you write an abstract. Whether you are going for a conference or you are going for a journal submission, you need to develop your manuscript. You submit it to the journal. The journal probably says you should make some revision. They send it back to you. You make the revision, you submit it back to the journal, they accept it, and then they publish it. Now, when you are a beginner, the suggestion is that you should not try to publish multiple papers at the same time. Start with one and complete the whole process till it gets accepted. Once it gets accepted, you can start with the next cycle. But once you become an experienced researcher, you can be doing multiple research at the same time. But from the start with one and complete the whole circle. Now, these time periods are not exactly the same for every study and not the same for everyone. This is supposed to be flexible so that it doesn't put too much pressure on you. But typically, from identifying your topic to reviewing the literature, doing the proposal, getting ethics, data collection, writing, submission, anything between 1 and 6 months is fast. So if you can make the time to do it, these times can be more than half. But if you cannot make the time, you don't need to put too much pressure on yourself. It's a gradual process. You start gradually and you build upon it. Now, what can we do in African universities? We need to build mentorship clubs within the universities. We need to be able to share data. And whenever it is possible, writing retreats, we can go on a writing retreat. In that university, you go on a writing retreat and everybody gets, those times are blocked for writing. So you write. If the universities can also get some seed grants such that researchers can access, that might help. Protected time for research, that might help. And then collaborating across countries. Now, you don't need perfect conditions to start. Identify one problem, ask a question, develop a study that is feasible, that is relevant, and then begin to make steps towards carrying out that work. Now, if we all who are in this call can make a commitment that each one of us is going to develop a topic and work on it. This is towards the end of May. If we are all committed towards it, then from now till about 6 months, which takes us to around October, November, we should have had a study, designed the study, applied for ethics, and gone out to start collecting data. If we can all challenge ourselves to do something like that. Now, what research problems are visible in your imaging department or your academic department in the university today? What are some of the barriers that stop staff from publishing? What can be solved within 6 months? Now, this I want us to talk about. Okay. Research begins where observation meets action. If you observe and you do not take action, research doesn't take place. This is all that I have for now, and I would be happy to take questions and for us to have a meaningful interaction. I didn't envisage this to just be me talking and it ends there. I want us to be able to have a conversation, and if there are commitments that we can make, then we can make those commitments, because we want to get work done. We don't want it to also end up being a talk shop. We want to be able to get work out of this group published. So thank you, and I'm available for questions and general discussions.
Okay, guys. Can you hear me? Good evening. Can
Yes,
we
I
hear
can
me?
hear you.
Yeah.
Yes, yes.
Yes, please go ahead.
Okay. I think the moderator is having a network issue, so I'll step in for him. First of all, we would like to thank Dr. Abdul Razak for such an insightful presentation. Uh, we can while we're doing this, you can drop your question in the chat box, or you can unmute and ask. So, sir, we are very grateful for your session today. It was very insightful, and more insightful when you even talked about uh, how to see problems around us, and be able to structure it into research questions. So, sir, I have a question. So one of the challenges that we're facing in Africa, research-wise, is the lack of availability of data, right? Because you made mention of most people in the Western world, they do research, they get a conclusion, and they shift their conclusion to Africa. And we don't have any choice but to try to implement, because we don't have our own data sets. And we've seen cases whereby people that love research, they go to diagnostic centers, hospitals to collect data, and these institutions shut them down. Oh, we cannot release our data. It's patient privacy and the rest of it. But we know that the profession cannot um, improve if we, because it's research that precedes practice. The profession cannot improve if we continue this way. Are there any structures in place? I mean, you've practiced videography in Africa, you're practicing videography from a global view. Are there any policies in place on how to address these challenges of collecting data for research, especially for institutions that are there ways we can bypass this? That's my question.
Okay, thank you very much. That's a common challenge across Africa. Um, I don't know why people are so reluctant to release data. The thing actually is we don't need the patient names. We anonymize the data. So the fear of patient information being out there, it's really not a genuine fear. Now, one of the ways I have tried to go around it is I have involved radiographers who are in clinical practice in those studies. So, for instance, there is currently a study that I'm doing with some radiographers and a radiologist in clinical practice about some CT examination with nerve block. We are looking at replacement of the needle during nerve block procedures. Now, on my own, when I wanted to get data to do that research, they were not willing to give the data. But then when I involved the radiographers and the radiologists there, they were now willing to share the data. And I was like, okay, I don't even need your data coming to me with patient information. So anonymize that data before I even have access to it. And this I had said beforehand, but they rejected. But now that they are also involved, all of a sudden, it's not a problem. They are now okay to give that data. So I think one of the things we might have to consider doing is to look at whether we can get the radiographers and the radiologists in those clinical area to help us get access to the data. I added radiologists because In some of these facilities, the radiologists are the heads of department and would not allow it if they are not a part of it. So that's why I said radiographers and radiologists. So far, that's the only way. There is nothing else that I know that has worked in being able to get that data. And the bigger challenge it gives us is, see, for instance, data that is used to train AI models is basically data from Western conditions. Now, if we apply that AI in our setting without the large data set that is needed to train these models are not going to be as accurate as they are with the data from where they were trained with. So it's a bigger problem if we do not take action about it. Unfortunately, leadership doesn't seem to care. There's a question, I think. Okay, so there's a question here that says, how can one develop a data set in CT for research in Africa? Okay, so for instance, patients, let's say the area that you want to research on in CT, it's say radiation dose to patients, infant patients between age, say 0 to 6, who do skull X-ray. Now, the radiation dose for each patient is recorded on the CT. So that data is saved on their system, the system of the CT, and you can retrieve that. So if you are a radiographer there, you should be able to retrieve that data. But mostly, it's not ethical for you to retrieve that data without getting permission to do it. So that's why we normally say that you need to apply for ethics. And once they grant you the ethics, then they might then allow you to take that data. So in CT, in MRI, in X-ray, most of those ones, when we want to get the data we normally will get it from PACS. And most of these, because of digital imaging, all of them have PACS systems or radiology information systems, so we can retrieve the data from those sources. And in those cases, it has to be retrospective studies. Otherwise, we don't want to expose patients to CT radiation just for our study.
Thank you very much, sir. My question was answered. Miss Patience, I hope your question was answered. Are there any other questions? Okay, we have a question on the chat box from. So the question says, I have encountered rejection in an attempt to publish a paper. All I keep getting is it has been done already. But actually, what has been done was for a specific region in my country, and I decided to replicate it in a different region. Is the rejection a result of the same country?
Okay, so Irene, I think one of the things that you need to do is make your work a little different from the work that they refer to. So, for instance, even if it's in the same country, you can find a way to make your work different from it. Now, I haven't seen the specific work, so it's going to be difficult to comment on it, but I'm happy to have a look at your work and then the um, other work in question, then we can work around it to find a way of getting it out. And sometimes if one journal, so for instance, I was um, working on a paper on sustainability in radiography. Then when I submitted it to Radiography Journal, they said they had published a paper on sustainability in radiography out of Ghana. Now, it was not, that paper was not similar to mine, but then they said they had published one from Ghana, so they didn't think that it was going to be right to publish that. I didn't change anything in the paper. I submitted it to a different journal and it was published. So I might need to have a look at your work, then we can find a way of fine tuning it to see how we can you can get it out there and published. Um, Patience, the what exactly is the issue with the radiologists? They are not willing to work with you. So see, one of the things about the radiologists is that a lot of them don't know how to do research. Okay. So you might have to tell them that when you do the work, it will be published by both you and them, and their name would be on it. And once you are done with the work, you bring it for them to have a look at it before you submit for publication. And let's see if that's able to help in any way. Um, yes, the reason you need to read what other people have done is that you don't want to go out there and do what somebody has done already. So you would need to, so for instance, let's say I want to travel on a road and somebody else has traveled on that road. I want to find out what their experience is. But in research, the thing that makes it different is if somebody else has done that work and you do the same work, it's going to be difficult to get anybody to want to publish that work. So you want to see what they have done. And then looking at it, you can say that, okay, these people did this work, but this part of it, they didn't do it. And that is the part that I am doing. So it gives you context. So once you read their work, it gives you context.
Okay, do you still have any other question? Thank you very much, Prof. Do you still have any other question? All right. I presume the silence means there is no other question. I can't see any on the chat box. So before we round off, I'm seeing one of our mentors for one of our mentors for this program for the scholarship track. Is on the call with us, Mr. Wisdom. I don't know whether you want to say a word or two before we proceed.
Hello, good evening, and thank you for calling me on to just say hello. I actually joined because Prof is my mentor, and then I wanted to get some bit of insights from his presentation today. So I don't really have anything personal to add from what he has done so far. So thank you so much.
Okay, thank you very much, sir. Thank you very much, sir. Yeah, someone added an opinion on the chat box. You're saying leading literatures enlightens you on recent study gaps so that your research will be relevant. Yeah, so that adds to what Prof said. So before we conclude, I want to let us know that we still have a couple 2 more sections. I think I should bring it up so we see. We still have 2 more sections or 3. Sorry, let me share my screen. No, okay. So we still have this is how the program is running. We are currently at phase 2, and phase 2 will be rounding off by next month. So we have yes, Prof. Someone is asking for where they can get in touch with you, whether it's on LinkedIn.
Oh, it can be on LinkedIn, and I can put my email in the chat as well, so that's not a problem.
Okay. So we're currently at phase 2. So this is the first section for this scholar. Sorry, research and publication track. We have 2 or 3 more sections in May. After which we would proceed to the trial and application phase, which is the phase 3. That will be coming up in June, whereby we would start grouping ourselves and all the insights, especially the insights we gathered from today about looking around us and seeing challenges that needs to be addressed. So from there, we can be able to drive, because the research questions, the research we're going to be working on this program, it's not just for the sake of publication, right? It's principally to address a challenge, a problem that is bedevils medical imaging practice in Africa. Then, secondly, to have a publication out there so people could also see the challenges so as well, and also the recommended solutions to it. So, the trial and application phase will start in June. So by next month, we'll be having 2 more sections on this. Then we'll proceed. That goes to other tracks too. Yeah. So, in absence of any other question or addition, so we want to thank you once again for this session. We don't take it for granted, especially being that we reached out to you and there was no a lot of back and forth. I mean, we have many mentors in this program. There were a lot of people that we had to pitch, convince, but it was not the same with you. And that shows a lot of passion that you have in mentoring young people like us that want to also be able to explore the opportunities that are in the profession, and we don't take it for granted. So,
Yeah.
we also no, you can talk, sir.
No, it's okay. It's fine. Thank you. Wisdom. It's I don't know what to say. Wisdom is one of my students from when I was at the University of Cape Coast. Yeah, so I know Wisdom personally. He's a great guy. I'll put my email and LinkedIn in the chat.
Okay. Thank you very much, sir. Thank you very much, sir. So, I just wanted to ask, right? So, if is it also possible, like if you're working on a research project and you need research assistance, is it also possible that people from this group, if they're interested, that they could also like join you, probably help you share questionnaires or anything like that?
Yes, that's fine. As long as the person is it's serious about it, yeah, we can do work together. Hello? Can you hear me?
Okay. Thank you very much. Thank you very much. So yeah, this one.
Yeah, so I'm open to it. I see me, it's more about if you're interested in working, I'm interested in working with you. That's it. That's all.